My name is Jillian Fickenscher, and I graduated from Hastings College in 2008. I am currently a physician and just starting practice at the York Medical Clinic in York, Nebraska.
And I'm Brady Fickenscher, and I graduated in 2008, and I am also a physician starting at the York Medical Clinic in York, Nebraska. Typical day in family medicine is not always typical. You see a range of ages from newborn babies to people in the nursing home. Sometimes you're covering the emergency room, sometimes you're seeing patients in the hospital. And so a day is always exciting.
One of my favorite parts of the job is delivering babies, because then we not only get the relationship with the mom throughout their pregnancy, but then we deliver the baby and then we get to watch that child grow up and really be part of the family's lives, have that relationship with them as their family physician. I was always interested in family medicine. I grew up in small town Nebraska, and I liked the idea of taking care of all ages and whole families. And when I came to Hastings, I was able to kind of expand that a little bit and add to that desire by adding an interest in public health as well. And some of the experiences I had here through service learning and things like that really helped me grow that interest.
Definitely laid a foundation for the beginning of the medical career. And so it was here that we met each other, and we're able to kind of help each other out, and became study partners throughout both undergraduate and medical school. So it's kind of surreal that we're actually at the end of the journey when it started here. Thank you, Dr. Morris.
Yeah. We met in our freshman biology lab as we were assigned to be lab partners. I always say we were assigned because it wasn't a choice necessarily, but we paired up well, worked well together, and started out, like Brady said, initially as study buddies, and then ended up dating through the entire college. We met in our freshman year, so worked out, and we've been on the same road together ever since.
I mean, I have to give a lot of credit to the professors here at Hastings, and just in challenging us and guiding us during undergrad, because that really does kind of lay the foundation in terms of preparation for medical school and medical training, as well as just guiding you through the application process and everything like that. Getting to know them, and some of them even have a lot of experience applying to professional schools, and so they were invaluable when it came to the experience.
Keep working hard. You know, it is a lot of school. You're looking at not only finishing your college career, but then entering a lot of times a four-year, professional program with medicine, and then your residency years where you're just putting in a lot of hours, kind of getting your on-the-job training. So it is a long road, but just keep working hard. There's always going to be people around you supporting you, not just in your school environment and your training environment, but your family and your friends, and those are the people that are going to keep you sane through it all. And so just keep working hard and reaching out to those people when you need it.
In terms of resources, and extra guidance, I mean, we'd be happy to visit with students that wanted to pursue medicine as a career and take questions and things like that. And I think having alumni that are actually living, some of the careers that kids are pursuing, I think it's a good tool.
I remember, being here as a student, some of the docs that were practicing in town or nearby would let me shadow, or give me resources or contact information as far as applying for medical school, and I thought that was invaluable. And so I think the alumni connection is great. With being part of a campus like Hastings College, you're part of a big family, and it's easy to reach out to anybody. So we're happy to be a resource to anybody who needs us.